The last topic we're going to cover this week is surgical interventions. So we're going to start with the development of lobotomies and talk a little bit about that, and then move on to more modern therapies. So lobotomies were developed around the 1920s as a way to treat patients who were profoundly agitated, aggressive, and violent. It was a surgical procedure where you go up through the ocular cavity, so through the eye, and sever the prefrontal lobe from the rest of the cortex. The intention was once again to take people who were severely violent and distressed and lashing out at people and aggressive and calm them. However, this wildly grew out of control and scope. And I would also say that performing a radical surgery where you sever the frontal lobe in order to make someone more manageable makes it easier on the caretaker, but doesn't necessarily help the patient. So some folks ended up being calmer, but some were left with severe brain damage, some died, some became vegetables. Rosemary Kennedy of the Kennedys was institutionalized because she had a mild mental deficiency, and she was perfectly capable of holding conversations and enjoyed like certain foods and talking with her family. They gave her a lobotomy. She ended up a vegetable, which was quite unfortunate. This became a very popular surgery. By 1951, 18,600 lobotomies were performed in the United States. The person who developed the lobotomy ended up winning a Nobel Prize. It was a very popular surgery, and it was done for not just the most severe of mental patients. It was used to treat migraines, which is kind of like a very severe fix for something like that. Dr. Walter Freeman was considered to be a big proponent of the use of lobotomies in this era, and he developed a technique that let him perform several within an hour. So he'd just line folks up on tables and go down the row with a little pick and just kind of do lobotomies on all of them, and he thought it was a miracle cure. Thankfully, the development of good antipsychotics and antidepressants in the 50s and 60s helped stem this particular tide, but for a while there, it was a very common surgery that was fairly extreme, and led to a lot of people getting permanently damaged and dying, but it was thought to be the best possible thing that we had at the time. I'm going to show you a brief clip from an interview by a man called Howard Dulley, who was actually given a lobotomy when he was very young. He was 12, and he was given a lobotomy because his stepmother had a lot of fights with him and thought that this would be the solution to sever his frontal lobe from the rest of his brain at the age of 12, because they got into fights every now and then. It's really, once again, astonishing that she should think of that as a solution and that Walter Freeman would agree to it. He was the one who performed the lobotomy. That's actually a picture of Howard laying right there, and Dr. Walter Freeman's hand, and he's being prepared to receive his lobotomy. He survived the procedure, and because his brain was a little bit more plastic due to his young age, he was able to recover in part. But one of the things that Howard reports when he talks about his experiences is that after the lobotomy, he had some distinct trouble with things like decision making and impulse control. He had trouble with substance use and anger management, and he felt a sense of disconnection from the people around him. He's since grown up to be a fully functional adult, although he bounced around from juvenile prison to home to children's homes to all sorts of different places. He was homeless for a little while. He found it very hard to function for a very long time, and it took him a while to figure out how to be because of this particular act. So it's important to understand that we used to do this a lot, and to understand just a little bit more about that as a part of our knowledge about why this sort of thing is something we don't tend to do anymore. Electroconvulsive therapy is where there's an electric current that causes a seizure or convulsion, and it's passed through electrodes on either side of the head. Now, we tend to think of ECT as some form of torture. It's not unheard of to have a room in a haunted house where somebody's receiving electroconvulsive therapy and they're thrashing and screaming and it's painful and, it looks like torture. But it's interesting to note that the process of passing an electrical current strong enough to cause a seizure through the brain is actually considered to be a quite effective way of treating someone with severe treatment-resistant depression. So even though we used to give ECT across the board for all sorts of therapies, especially for patients we consider to be problematic, we actually still prescribe ECT today, and I know someone who uses it. One of my childhood friends has severe treatment-resistant depression, and she goes in for ECT sessions about once a month. Now, these days, the patient is sedated, there's no thrashing, there's no screaming, it's all very controlled, and she benefits incredibly from this particular therapy. So it's still used to treat very severe depression. People who have severe depression will report that it's like the curtains part and they feel absolutely normal, at least for a little while before their symptoms return. It's almost like it resets their brain. So it's not long lasting, but it can provide some relief for folks who are otherwise treatment resistant and once again suffer from severe depression. It can be problematic, so side effects include some memory disruption and issues, especially in the immediate aftermath. There's some short-term memory loss. And I would say, once again, you have to kind of balance the cure with the side effects to see if it's worth it. My friend believes that it is, and she also has to limit her visits so that she limits how much damage she's causing as a result of the treatment, even though she finds it very beneficial. Other things that we've started to develop include repetitive transcranial magnetic stimulation, where magnetic pulses are applied to the cortex. It's considered to be slightly less invasive and severe than ECT, but has a similar sort of effect. And then there's transcranial direct current stimulation, which uses scalp electrodes to pass low amplitude direct currents to the brain. We also have electrode implantation as well that implants electrodes within certain areas of the brain. Both of these can serve as a pacemaker for the brain, regulating electrical activity in certain key areas in order to keep the brain from either being overactive or underactive. And I'm going to go ahead and attach a video that you can watch that's a TED Talk about this as it's used to treat some symptoms of Parkinson's and is being developed as treatment for depression. So it can regulate dopamine production, which can assist with movement disorders, and once again, can be one of the things that you can regulate in cases of folks with depression. You can imagine you can even implant an electrode in the ventral tegmental area, which is the part of the brain that's responsible for dopamine production, and kind of regulate it like a pacemaker to the brain. So hopefully you'll find that TED Talk interesting. I know I did.